Good afternoon. This is Harry Hobson, President and CEO of Plymouth Harbor, and this video is intended not only for our residents at Plymouth Harbor, but also we have uploaded it to YouTube where your family and friends can see it streaming online. So I wanted to say that as a reminder to everybody. What we're going to do over the next few minutes is bring you all up to date regarding, so what is Plymouth Harbor doing regarding the coronavirus? So before I reintroduce you to Karen Novak, let me work through a few things for you, okay? Let's start by asking ourselves, what do we know about the coronavirus today? Well, as it slows in China, that's going to pick up speed here in the United States, and we've already seen that. The first 2 deaths are reported in the United States, and more infections are detected. A Manhattan woman in New York State's first confirmed case, and the European Union has moved into high alert, as we may eventually arrive. And I don't think I have to remind anyone what the financial markets are doing today. I'm confident that things will slow down very, very soon. So where do we go from here? Just in a way of background, as the CEO of Plymouth Harbor, it's my responsibility to make sure all of our residents and our staff members both live and work in the safest environment possible. That's our passion, that's our focus, and I think you'll see that play out over the next few minutes in this video. The first thing I had to do was assemble my leadership and open up a dialogue. We needed to present the facts on the coronavirus. We needed to develop a baseline understanding, department by department, of what this means. And then we went into review mode by department to find out, do we have current policies and procedures in place on all possible infection control areas, or are we going to have to develop new policies and procedures? So we're working through that process right now. I needed to recognize my organizational resources. I'll talk more about that in a moment. And then create a communication plan, very, very important. We're also going to discuss with Karen Novak a few things that we should all remember. Well, from my perspective, early last week, it was important for me to define the need that we have here at Plymouth Harbor, and then think outside the box. I wasn't going to be restricted to the present organizational structure that we have here. Sometimes we analyze things to a fault, referred to sometimes as the analysis by paralysis. We don't have time for that. So we went into reorganization mode last week and trying to find the best person possible to move into a position to give oversight and direction throughout Plymouth Harbor from a resident perspective, from a staff perspective, and those that come on and off our campus as well. And right under our nose, we have our own Karen Novak. And I'm going to be dialoguing here in a moment with Karen. In part of our communication plan that was very, very important, and that was to get out and meet with the residents and staff. So we had my cafe chat last Thursday, and last Thursday we covered a lot of information. We're going to talk a little bit about that today, but probably one of the biggest takeaways from that was to know that we have a focus on this, and we have identified someone specifically, again, that's Karen Novak, to really lead our team through this effort. Okay, so what I'm going to do right now is come over here and introduce, and in some cases, in most cases, probably reintroduce Karen Novak to you.
Hi,
and Karen is our Director of Nursing Services for the past 7 years.
Correct, in the Smith Care Center.
Smith Care Center. But I'm going to ask her to tell you more about herself and why this selection was so easy for me to do. Karen?
Thank you. As you know, I'm Karen Novak, and I know a lot of you from the Smith Care Center. I've been a nurse, a registered nurse, for 40 years, and I've done infection control for well over 20. Currently, I'm a certified infection control practitioner for long-term care, as well as certification as the infection control practitioner for antibiotic stewardship. Part of my past history, I worked doing research at the University of Florida looking at folate metabolism and how genomes play in the role of homocysteine and coronary artery disease. It's that cutting edge that I really found a love in, and I see us here at Plymouth Harbor striving for that same cutting edge to deliver that current, sound basis to do our policies and procedures and strive for excellence.
Thank you. Thanks, Karen. As we talk about our communication plan, and I might ask Mary Ann to show that slide again, you can see that it was very important for us to identify the elephant in the room, acknowledge the current situation, and we need to stay with the facts as we know them today. We need to remind everyone of proper personal protective equipment, or as we refer to it, PPE. Very, very important here. It's a constant reminder to us to help contain any opportunity for a spread of infections. Get people thinking about the worst case scenario. We do a pretty good job with that. We have an emergency management or response team. We've had it for years here. It's tried and tested, but it's always been focused more around weather conditions like hurricanes. We've added a third leg to that stool, and that's going to involve Karen as part of that leadership, and she's going to bring her knowledge and expertise as it relates to this area into our emergency response team. And then also, probably most important is we've got to offer resources to help manage any potential anxiety with our residents and also with our staff. We're going to do that through our social services department and also Chaplain Sparrow here at Plymouth Harbor. But we can't forget our employees as well. So a very important component of our employee benefit program is our Employee Assistance Plan or program, the EAP, and we're making that available. We use it from time to time for other challenges, and we're going to make it totally available for any staff members that might be feeling some level of anxiety. So Karen, let me shift over to you and maybe reflect a little bit and beyond of the cafe chat last week. We talked about some precautions. Maybe you could go into that, and I think most of us are really curious, what kinds of questions have you gotten over the last few days?
Well, we'll start off with the precautions and preventative measures that each one of us have a responsibility to carry out. And you can do them without really thinking about them if you start to incorporate them into your lifestyle. The first one that we have is washing your hands. It's something very basic that we all do. Utilizing two sources, and I'm going to use Harry as my Vanna White if he doesn't run away.
I'm coming right back.
Okay. Looking at your alcohol wipes, the alcohol gel, you want to make sure that it's got 60% base alcohol in it. You're going to use enough there to really get your hands moist. And when you're doing this, really hit the cuticle areas, because that's a lot of time those little virus bugs and the bacteria will settle right there in the cuticle. Make sure that you allow that alcohol gel to dry. None of this wiping it on your pants or using a towel. You want to make sure that that alcohol does what is called a kill rate, getting rid of those organisms on your hands.
Karen, I know last week I impressed you with the way I washed my hands. And
you're still doing well.
I'm still doing well. But I went on YouTube before our meeting last week, and the reason you see me doing this is to get the nails, the cuticles, as clean as possible. And right now they're dry.
And that's perfect. That's exactly what we want to see. But also, sometimes after using these alcohol gels about 5 or 6 times, it gets a little gummy. So you want to make sure that if you have the opportunity, by far, washing your hands with soap and water is preferred. So go ahead and lather up really well with some soap, a nice antibacterial soap. Get it all lathered, and when you're washing your hands, really get in between, especially like within the webs of your fingers, and then rinsing them in a downward motion so that whatever is on your hands is going to go down that drain. Then grab a paper towel. And I hear that we're getting possibly some new paper towels in some of the bathrooms.
Yes, all of the bathrooms, that's
which
correct.
will be advantageous. We're going to take that paper towel, we're going to dry our hands with it, and then we're going to take that same paper towel and turn off the faucet, as well as open the door with that paper towel over our hands so that we don't have that direct contact with either the faucet handle or the actual door handle. We want to clean those high contact areas that we use each and every day in our apartments or around the actual Plymouth Harbor facility itself. Doorknobs, phones, iPads, things that we're using all the time, our elevator buttons. Go ahead and wipe them down. You can use a bleach-based product. You can use a hydrogen peroxide product, and sometimes that's preferable if you've got any kind of cloth near it, because that bleach-based product will actually change that color of whatever you're cleaning down, and you really don't want to do that. But also the antibacterial. If you look at some of the Lysol wipes that we currently use, they're in like a yellow round tub. They have a 99% kill rate, meaning they're going to kill 99% of those viruses and bacteria that actually lay on your surfaces. And they do address the coronavirus, so that's one relief we can say. If you are sick, stay in your apartment. Please don't go out to the dining room and go sneezing and hacking over everyone. That is just not a lot of fun. The last thing, I think someone brought up that they went to the opera, and someone was hacking at the opera. Well, you know, we have the ability to say, you know what, I don't want to be a part of this. So you can either move away from that person that is coughing, or you can ask for some help, because chances are that opera facility is not going to want that person sitting infecting a number of people. So be proactive. Go ahead and say, this is not okay, and make that call to either move or get some help. Let's see. This cough or this cold with this virus has what we call droplet precautions, meaning whatever you're spewing out of your nose or your mouth are large particles. And we can actually utilize a mask for those that are sick to keep that virus within that area, which is the resident or the person that's sick, and not spewing out any kind of virus spores. Ideally, it's going to be just a regular surgical mask that's going to go over your nose and mouth and then clip behind your ears. Let's just be sure that you do indeed fit or pinch your nose so that it does fit to your nose. Now, this doesn't mean it's what we call an N95 mask. These are the ones that you're going to see at the hospital. These have a higher filtration rate for the aerosolized particles of some airborne transmitted diseases. And these are something like shingles or TB. Now, too, you may see the healthcare workers in the ICUs utilizing an N95 mask, but those are patients that are usually intubated and have a direct, pathway to get into the resident lung and have those organisms exposed. But really here, you don't need a mask. If you are a normal, healthy human, you really shouldn't be wearing a mask at all.
Okay, very, very good. Karen, you've been asked some questions, I know, in the last few days. Is there any question that kind of pops into your mind that you might want to share today?
I think a lot of residents are kind of concerned regarding travel. We have a few residents that have been going outside the country, and I would recommend wholeheartedly that you actually check on that CDC website to see if there are any travel restrictions for whatever area that you're going to. We do plan to add a travel health kind of bulletin out so that you will have the latest and greatest insight and knowledge with what the CDC is recommending, as well as if you have any questions, feel free, pick up the phone, you can give me a call. I'm not sure what my phone number is going to be yet, but nonetheless, you can call me at SmithCare at 510 right now. But, ask. I think communication is probably the most successful way in preventing a negative from occurring to you or your family.
Karen, let me close out with that because I was asked a question the other day at the conclusion of the cafe chat, and that is, okay, now tell us how to access the system. Let me start by saying, I'll go back 10 or 15 minutes and say, remember when I mentioned that we didn't want to start this program when we had everything figured out. It was more important to get involved. We're working all the details out. But what I can tell you regarding that detail, if you have any questions or concern, you have a couple different options, okay? First of all, as Karen said, her direct line is 361-7510. It's area code 941. I'll say it again, 941-361-7510. If you're calling from on campus, it would simply be 510. You can also send Karen an email. Her email address is Karen N. N is in Novak. So it's Karen N at PlymouthHarbor.org. And then the other way is to simply write down your question and drop it off at the concierge desk in the tower, in the main lobby. So our plan is to continue to update you every few days regarding any additional information we have. We're planning on having all staff meetings later this week to do the same type of communication. We started some of that last week. We'll continue that as well. And please feel free to make any suggestion you might have.
Absolutely. It's going to take the whole village this time to really address things, and we're going to keep you informed all along the way.
Good. Okay, thank you very much. We've asked that this video be placed on channel 195, and also it's going to be uploaded to YouTube so your family and friends can watch it while streaming on the computer. Thank you very much for listening in today.